Good evening, fabulous ladies at home. I'm Dr. Melanie Ochalski, reproductive endocrinologist and certified menopause practitioner, and I'm here with the fabulous Dr. Kelsey Steele, who is back by popular demand to do another menopause chat with us. Thank you, Dr. Steele, for joining us today.
Absolutely. I love it every time.
We're like a team trouble here because we're talking about all the exciting things we're going to be discussing tonight. Tonight's topic is menopause and the emotional roller coaster. And the reason why this topic is, I think, particularly important is because I think we all go through phases in our life where we may have some mood changes, and mood disorders can occur anytime in life. But we do see an increase during the perimenopause and menopause transition, during which patients are reporting mood changes and having some negative effects from those mood changes. So tonight we want to talk about why that may happen, when someone should seek care or evaluation, and what some treatment options can include. And Dr. Kelsey Steele is a certified psychologist, and we have done webinars and lectures before. And as always, we want to invite the audience to participate as much as possible. There is a feature where you can type in your question, and we will try to get to all of the questions that we can. If there are any that we can't address, we will try to reach out and get you some answers, as long as it's something that is answerable. So, how's that sound? Perfect. Okay, so it is very common that a patient will come to me and say, I feel like I'm going crazy, but I just don't feel myself. Like things are agitating me, and it's not typical for me. So I'm not feeling normal. Is this hormones or something else going on? Another complaint is, I love my family, but I can't, or my coworkers are great, but they are really getting under my nerves, and I'm normally not this irritable. So I think one of the important take-home messages of tonight is that mood changes are a very common piece of the menopause changes that happen in the perimenopause and menopause. And when I talk about perimenopause, I'm referring to the approximate 10 years that precede when you would get your last period and be officially menopausal. And the perimenopause is just as important as the menopause because there are a lot of hormonal changes that often can come before we even see changes in your period. So you might not otherwise be aware that hormonal changes are happening, but that's a time when mood changes can start to occur. So when I have a patient who is talking about having mood changes, it's normal, but it's something that needs to be addressed if it's causing distress to the patient, to the woman, or if it's affecting relationships. It's not uncommon that I have a patient say, I almost lost my job because, things that you used to be able to bite your tongue over, you don't have that reserve anymore. So the first thing I'll ask is everything else in your life and health okay? One of the biggest things that can really exacerbate mood is poor sleep. And there's a lot of reasons why sleep gets disturbed during this time. I think the top 3 would be hot flashes, And sometimes they can occur pretty infrequently, so you don't even, really notice that. You might think, oh, I'm a little, my pajamas are a little wet. And so, but hot flashes can be really disruptive. Two, I have to go to the bathroom, so I'm waking up every night to use the bathroom. And three would be, I don't know why I wake up. I feel like at 3 a.m. or 4 a.m., my mind is, I'm thinking about everything I need to do that day. And so to that end, if Dr. Steele, when you have a patient who is feeling as though she knows that her sleep is disturbed, what are some of the things that you think about when you're trying to help that patient?
This is a really potentially loaded question, right? Because so many things impact sleep. But realistically, it's that piece of, people really want to fight their sleep often, right? Like we want to really say, like, okay, I'm going to go to bed at this time, even if we're not tired. Like we try to create a routine, which is very helpful for sleep. But if we're not feeling tired and we're trying to force ourselves, it's not going to be super helpful, right? If somebody's up and recognizing what time it is, let's say it's 11 p.m. and there's somebody that goes to bed around 9:30, 10, it's 11 and they're still doing tasks because they're not tired and now they're frustrated, fighting sleep is not going to help, right? But coming up with a good nighttime routine, realistically, which means turning off phones, right? I don't know how many people are in bed either on their phone, tablets, computers, TVs. So much activity happens in the bed outside of just sleep or sex, and that can really disrupt sleep. Other options, or that good nighttime routine would be like not drinking any caffeine past a certain time of day, really making sure that we're limiting water intake or any type of food consumption, something that's going to give us energy, right? Like nighttime snacking, things like that, we really want to reduce. So we're not energizing ourselves right before we're trying to go to sleep.
And I know this, but how often right before bed do I need to snack on those darn cookies and stuff? So it's good to hear you say these things.
And others really trying to kind of next day prepare too, right? So if we're feeling really tired because we didn't get a good night's sleep, we wake up, we're already thinking about how today is going to be terrible, right? We didn't sleep well, we're grouchy, it's already going to be a stressful day. So maybe we get off early and we want to take a nap. Like definitely not super great, just because the more rest we take during the day, it's going to push back our ability to go to sleep at night, which is going to just perpetuate sleep cycles that can become really unhealthy.
Okay. What strategy would you use for that patient who is waking up, she doesn't really know why, so she has no trouble falling asleep, but those that persistent wake up at 3 a.m. and you don't really know why, but you're thinking of XYZ. So one of the things that I talk to patients about, but I'm curious what you would say, is rather than get frustrated that, oh no, now I'm asleep, now I'm awake, and I'm not going to be able to fall asleep forever, I'm going to be tired tomorrow, and then you kind of escalate, and now you're really like, not only are you awake, but you're angry and stressed. Just kind of acknowledge, I'm awake, but it's okay, and try to relax yourself and hopefully ease back into sleep.
Some strategy, I think that's a really good strategy, is the more negatively we think about it, the harder it will be to go back to sleep, right? Because then that's when we start fighting ourselves, and that's when we just wake ourselves back up, and then that's how we're going to start our day, is frustrated, and it's going to really pour into the rest of everything else. Some strategy, so like some treatment for like sleep disorders or things like this, would really say to not lay in bed for more than about 15 or 20 minutes. Which probably feels very contradictory to wanting to go to sleep. But the more that we lay there fighting with ourselves, wanting to go, to sleep, we're tossing and turning, and now we're starting to build associations negatively of, oh, what am I going to do here? Right? I'm just going to lay here. I'm going to toss and turn. My partner's just sleeping soundly, and that just irritates you even
Yes,
more, right? When you're tossing and turning. So doing, it might be helpful to get out of bed, not do anything that's super entertaining. Don't go turn on your favorite show or read your favorite book, right? But do something a little bit relaxing to kind of bring your body back down. And then when you start to feel tired, going back to bed to try to lay down.
Okay. Mm-hmm. That's good. That's good advice. I had a friend who, whenever she would wake up, she would just start like ironing or she got a lot done in the middle of the night.
Mm-hmm.
But probably that's not a good idea. Something a little more mundane to ease you back in.
Mm-hmm. We don't want to turn on a whole bunch of lights and do a whole bunch of things that are going to stimulate. Exactly. If we're somebody that can fall asleep to the TV or something to where that's not problematic, that's fine. We don't want to disrupt people's natural coping skills of being able to do these things, but recognizing that threshold of like, okay, I can have something on or do this activity without it actually like waking me more up and being exactly that, stimulating.
Yeah. And just to kind of bring this back to our theme tonight of the emotional roller coaster that can happen during menopause. What I have found is when sleep is disturbed, then you are more irritable and tired and fatigued the next day, and that affects your relationships at home, at work. You are less likely to be motivated and have the energy to exercise, more likely to possibly make some bad diet decisions. And so then you get into this habit of now you're not really being active because you're tired. You might be eating more. Now you're gaining weight. You don't feel good about yourself. And so you can see how this kind of spirals. And even, when you go to bed, now you're tired, but your sleep quality isn't that good. I've seen that it can easily impact libido, because when you're in bed, you really just want to sleep. And so now it's affecting intimacy. And so what starts with something that is very common and, you might not even think much of it, not sleeping, can quickly spiral into something that is really disruptive and sucks away your quality of life. If hot flashes are what is waking you up, there is so many good, effective, and safe treatments for hot flashes, hormonal and non-hormonal. So I do think if sleep is disturbed, first question that I would have is, why is it disturbed? What's waking you up? And then we can start to begin to provide remedies for how to get you a good night's sleep. They did a great study many years ago of women who were going through the menopause transition. And I think we've talked about this before, so Dr. Steele knows this study. But they took women coming into a menopause clinic, and they wrote down their list of all the complaints and issues they were experiencing. And their clinician did one thing for all those women, gave them a low-dose sleeping pill. And just doing that and giving women back good sleep made everything on their list get better. So while I'm not in any way saying sleeping pills are what's going to fix everything, that's not my message. But my message is that if you're having poor sleep, it will definitely make many parameters in your life, especially your mood, better by fixing sleep. So sleep would be one thing that I think is an important issue to address. The second question I ask a patient who comes to me reporting mood changes is, has this ever happened before? If it is hormonally exacerbated or induced, then very often that woman will have a history of PMS symptoms or postpartum mood changes or postpartum depression. It's not that it's impossible, but it's less likely that in a woman's entire life, everything has been completely, she's been stable through hormonal changes, and then suddenly at menopause, mood changes will develop. So it can happen, but very often if hormones are the sole culprit, there's a history of it. And that also doesn't mean that everyone that has had PMS or PMDD, premenstrual dysphoric disorder, or postpartum depression is going to have mood changes at menopause. That's not the case, but it does make it more likely if that was part of a woman's history, that the mood changes that are taking hold during menopause can be the hormones. Then we can blame it on the hormones for sure. Now, even in that situation where we are kind of blaming the hormones, typically, if we're going to start a treatment, the first thing we think of is some of the mood stabilizers. And the way I explain it to patients are that when you are going through the hormonal transition, the menopause transition, your hormones, which normally are predictable and we can anticipate how they're going to feel at different times of the month, suddenly it's and so it's less predictable, more erratic, and the peaks of our hormone production can sometimes exceed what we're used to in a reproductive cycle. The naders can persist longer and be lower than what we're used to. And so that all kind of can make you feel a little bit off kilter. And so when your hormones are doing the wishy, the roller coaster, I think your neurotransmitters are trying to keep up and they can get a little thrown off. And so if your serotonin and dopamine are kind of being provoked and changing, then that's the role that the mood stabilizers can provide. And I like to explain that because so often I have patients who will say, no way, I have not been on a mood stabilizer my whole life. I'm not about to start now. And I think that it's important to stress if mood is really an issue and we can't fix it in another way, then there are good therapies, and most patients are not on them indefinitely. It's just during that finite transition time. But they're safe and very effective. Now, from a behavior standpoint, there are probably other options that you might go to in addition or before therapy. And I'm probably asking another loaded question because every situation is different. But if you have a patient who is in her midlife and she is suddenly feeling an increased frequency of anxious feelings, and just a little more irritable, what are some of the things that you might think of or go to for her?
I think one of the biggest things is recognizing that difference and not trying to label it prematurely, right? Because we all have bad days. We all have bad weeks. We all have stressors that might take a little bit longer to get through. And really in those moments when that typically happens, people use their coping skills, right? Like they start to do maybe some mindfulness or some meditation, or they start to prioritize their ability to do things, right? We're not going to take on every single task because we're already feeling overwhelmed. Mm-hmm. So part of that might be to recognize one's own limits in those types of situations, just in everyday life, because if we keep piling on, anybody would get more irritable and more overwhelmed and more anxious, right? From when our stress increases, we're more likely to experience symptoms of anxiety or depression because our system is just overloaded with things. So I would say, like, always really being mindful of our ability to engage in self-care and to do those things. And self-care doesn't mean like going to a spa every weekend, right? Right? Wouldn't we love that? We would, but not feasible for everybody, right? So it's more so trying to find those activities of taking time for oneself, or really trying to bring down that physiological response. So anxiety is when we're heightened, right? I haven't gone through menopause. Hopefully that doesn't ruin my credibility with this, but
No.
With that, I would assume that the body experiences a lot of different sensations, which can be probably cause for concern, right? Of not understanding what's happening. And so really having that open dialogue with the provider of, hey, is this normal? What's happening in my body? That's making me feel like I'm going crazy, or I feel really lethargic and I don't have a lot of energy. And so really trying to, I guess, like talk to try to normalize some of them, because for some people, the symptoms themselves are very anxiety provoking, right? We don't like what we don't know.
Right.
It's scary.
That's a great point. So I'm just going to pause real quick, because something like hot flashes can occur, can be experienced in different ways by different people. So many women will feel this wave of heat coming on, and then they can feel like they feel heat coming out of their scalp. They start sweating. But for other women, it's this sense of doom, and they don't really know that's happening, or like they'll feel like their heart will start racing and something is wrong. And so it could, now we are learning that a hot flash is a cardiovascular event. You can measure changes that are happening in the blood vessels that precede and occur during a hot flash. So to your point, if this is happening and it's sort of happening below consciousness, so it's maybe low grade symptoms, and you feel like something's off, but you're not really sure what, I could see how then that is going to just add, it's one more thing that now you're going to be worried about.
Yeah, absolutely. Especially anything that is, not anything, I don't want to make that generalization, but a lot of the times when people experience those types of changes, like changes in heart rate or chest pressure or things like that, we think of a cardiovascular problem, right? Of, oh my gosh, what's happening? Am I okay? Do I need to go to the ER? Am I having a panic attack? Am I having a heart attack? And so even if the symptoms don't get to that severity in terms of pain level or things associated with heart attacks, it can be really worrisome, especially if people have that predisposition to anxiety already. Right. Of any type of health anxiety or going through it. So I would say probably some of that self-care, really reflecting, try to normalize, talking to a provider, that can provide some information about, yes, this is normal. Bodies go through this and it does look different. One thing I think that's important is that everyone has a good social support through this time, right? But then also that could probably cause some mood symptoms, because since everybody does experience it so differently, it can be hard of, well, no, that wasn't what my experience was like. What's wrong with you?
Right.
It can almost add to some of that perception of it being a you problem, rather than like a health and a transition and an adjustment period.
Which is another really good point, because you hear, I have a lot of women in my life, my family, who said, oh, menopause, I just exercised through it and it was fine. And so then when you start experiencing symptoms that you can't exercise through, it makes you feel like, what's going on with me? Is something deeper, more concerning happening? So that is another good point.
I think finding somebody that can validate and really empathize with that experience, because it is such a big transition, and historically people have very specific thoughts about menopause. And unfortunately, I'm going to make a bold statement that a lot of women's emotions are tied to menstrual cycles or this change in life. And that's not fair for any of us, right? Like, we're allowed to be emotional just like anybody else with stressors.
Right.
You know, it's not related to menstrual cycles.
Right.
But this transition also affects, I think, how people go through it with how they perceive the transition, right? If we go into any situation thinking it's going to be the worst situation ever and that it's terrible, then it might be that way, because what we're actually looking for are those symptoms and that difficulty, right? Not to say that it is in our thoughts completely, because it's not. Like, it's a hard transition, and this really challenges women's perceptions of femininity and identifiers as a woman. So it can be very difficult to work around some of those things as well.
Yeah. But what I hear you saying is step one is just identifying what you may be feeling. And maybe the more challenging next question is why you might be feeling it. Yeah, it's a lot. While we complain about getting our period every month and some of the burdens that go along with menstruating and then being able to carry a pregnancy, I think a lot of women, when it ends, that we are confronted with, well, what is, I identified as having this potential, and so it's a good point, which also makes me think about some of the other things that often are happening in our life. So in addition to this big physical change, often in a woman's 40s and 50s and 60s are when life is changing in other ways. So careers may be taking off, maybe changing, family dynamics may be changing after having a chaotic family life and raising children. Now suddenly maturing kids don't need you as in that way anymore, and so I think it can conspire to be mood changing, to say the least. So at what point, what advice would, so if there's a patient at home who's listening to this saying, oh yeah, I think like that definitely might be somewhat what's happening to me, what would be the initial tips you might give her, and when should she seek the consult of a PCP or a health professional, mental health professional like yourself?
I would say it would probably be time when things feel chaotic to the point where you can't cope, right? Where those normal strategies, let's say you're confiding in that support system that is truly a support system. Let's say you're attempting some of those self-care strategies and mood really is not changing, or it's not being impacted really at all. And when some of the lifestyle things that you might be attempting, that good sleep hygiene and exercise or things like that, when you're trying those and they aren't as effective, or you're starting to become very frustrated by them, right? Nothing is more frustrating than really trying to do something and not obtaining that goal, because now that could potentially cause, those mood symptoms to increase. Now that irritability is back up, maybe depression because of our self-esteem, if, we're not exercising or we've experienced body changes. So I would say when it gets to the point of feeling really chaotic, to where it feels like nobody understands, this is really frustrating, and for the first time I feel alone, right? I think that would be a really good time to reach out to somebody like you or to PCP, just to kind of talk about that experience, or to behavioral health. WellSpan has a lot of what we call behaviorists that are in PCP offices, several throughout the county actually. And that could be a really good first step of getting behavioral health help, even if it's not traditional outpatient. They're really brief sessions, and they're all psychologists in training. So really, really good support network there.
That is an excellent resource.
Yes, absolutely. Encourage everyone to go to them.
So that is something you can talk to your PCP about, and they can help get you connected with a provider like that.
Yep.
Very often, I'll have a patient who will come to me and tell me about mood changes, but her distress is due to the impact it's having on a partner. Like, I'm really irritable, or I have increased anxiety, and my husband just can't be my punching bag anymore, or something, to that effect. And when I have this funny story of when we first, several years ago, when the Midlife Health and Wellness Center started, my uncle came up to me and said, "This is great that you have this for women, but there really should be something for the spouses going through menopause with their wife." And I thought he was joking at first, but he really wasn't. And it can have a really profound impact on everyone in the family. So what I hear you saying, I think, is utilize the resources that you have, including your support system, spouse or close friend, but then know that within your healthcare community, there are people who are here and ready to help. And it might be a multifactorial approach, like if there's hot flashes or something else that's going on disturbing sleep, or if there's a need for a mood medication, we have great therapies for that. But there's also behaviorists who might be able to help you identify some of the symptoms that you're having that are causing distress, and maybe why they are so distressing to you.
Absolutely, yes. But I think we want to provide as much support, and we're not always as known. Behavioral health has a stigma. Hopefully nobody in the chat has one, but if you do, it's okay. We'll work with you. But we do have a lot of resources to help, because we recognize, this is a need. Women's health is as important as any other part of your life, and really trying to have that support. And you can use it preventatively. I know that I just said, when you start to feel alone, and I almost want to take that statement back, if you can come at any point, really. If there starts to be that frustration or irritability or that interpersonal conflict, that's a really big one with mood changes in general. But it's not to the point of being really problematic. Come talk. We would want to support you as soon as you would feel ready. And if that isn't, waiting till the last point where you're like, holy cow, I'm gonna,
right.
Yeah, you can come at any point to kind of discuss, like, how do I prepare for this? What kinds of things could I look out for? What kinds of things can I do? So,
and I'm going to kind of endorse that, what Dr. Steele just said, because so many of you guys in the audience and my patients want to do things holistically and naturally. And this is literally the most natural, holistic way to have an expert help you identify what you're experiencing and why you're experiencing it, and then give you tools to help get through it. There is data that even hot flashes, there's like tapping mechanisms and other ways of trying to minimize the frequency and severity of a hot flash. So that's a great, I like that tip.
I really appreciate you talking about minimizing the severity, right? Because I think some expectations can be that if they go to a treatment that it will be eliminated,
Mm.
right? And this phase of life, as much as I wish I could snap my fingers and change all of it, it is kind of about acknowledging what's happening, trying to accept, work through it, and make it tolerable, right?
Mhm.
Like make it to the point where it feels okay, to where it's not overwhelming, or to where it's not such that, I think you used the word like doom earlier, right?
Right.
Like sense of doom. Because that can feel obviously really negative and overwhelming. So it could be also kind of accepting like, okay, this is part of transition.
Mhm.
This is not the end of our life, right? It might feel that way at times because our moods, go up and down, or
Mhm.
like this. And so really trying to understand that concept as well.
Yeah, and not to get too granola-y and but I do think that our culture is all about fighting and resisting aging and maturity, right? And because we identify the menopause transition as this like closer to the ender, a later in life transition, we do tend to, maybe not celebrate it the way I hope one day we can celebrate it, that it's a great transition. And we spend a significant part of our life. If we go through menopause in our early 50s, and on average, women are going to live into their 80s, that's a long time to spend in this space. So we want to be thriving during it, and not, ignoring or trying to fight the fact that we're in that space.
I love sex, so I got to do just a little tiny thing about sex in here.
Okay, bring it on.
I got it, because with moods and menopause, sex is disrupted all the time. Like, and that's even with depressive symptoms or anxiety, outside of the menopausal stage of life. And with this, it can be a big impact with intimacy, right? First of all, our partner is irritating the heck out of us because we're just more irritable, and the last thing we want to do is be intimate. But this is also a stage of life that can be helpful in finding like good enough ways to be intimate without specific types. So, maybe one sexual behavior is not comfortable anymore due to vaginal dryness or things like that changes, right? And it's really can be a creative and fun way with your partner to try to expand what intimacy looks like, and to use things that are helpful to what's the word I'm looking for? To
be creative.
Always down for creativeness, yes.
Not what you're looking for.
No, but can assist, assist with some of the physical changes that come with menopause, especially with intimacy. So, that communication with partner and really trying to work through some of those things rather than, put it off to the side, because intimacy, whether it's sex or whatever is encompassing, or intimate behaviors, such as cuddling or things like that, that can go to the wayside with mood symptoms. And we see it often. And that's a quality of life issue.
Yeah, I have to agree that a lot of patients feel much more comfortable talking about their low libido, but only when you dig a little deeper do you find that, you're quarreling because you're annoyed at everything, and that's sort of undermined some of the relationship. Which reminds me that in many ways, sex is the window into a person's health and the relationship's health, and so thank you for bringing that up. And it now we have met my expectation that we cannot do a chat with Dr. Steele without talking about sex.
It's important. I'm going to spread all the sex education there possibly is, but
I like it.
Yes, and it really truly is associated with mood. I mean, we see that, because our bodies can't respond. So let's say somebody's going through menopause, right? And heightened anxiety. So not only is there the dryness and decreased libido, but our bodies respond differently to stress. So if we're stressed, our sympathetic and parasympathetic nervous systems, they don't work like this, they work like this. If we're stressed, lubrication is going to go down, desire is going to go down because we're in survival mode. Whereas if we're relaxed, if we're able to work through things, then we're able to actually be present and feel that. So,
I like that.
yeah.
All right. Should we go to questions?
Let's go to questions.
Okay. So, any questions that you may have, please feel free to just type them out. Okay, so first question is, I'm almost 42. Is this too young to be going through menopause? A little bit, but here's what the reality is. The average age of menopause in the US is 52 years old, which means that for the average woman, her last menstrual period will happen when she's around 51. And so that said, what that means is for that woman who stopped getting her period around age 51, when she was in her very early 40s is when the perimenopause likely started and hormonal changes started to occur. Now, a woman who is in her 40s can go through menopause, meaning she stops getting her period due to her ovarian reserve or egg quantity just declining way earlier than typical. And that can happen in your 40s, your 30s, your 20s, and even earlier. So it can happen at any stage, but it is typically women go through menopause in their very early 50s. It does tend to be heritable. So if you know when the women in your family have transitioned into menopause, that it can give you a good idea when you likely will. When menopause happens earlier than the age of 40 is when we usually will investigate why it happened so early, because there can be genetic or other disease states that can cause a menopause to happen early. So, all right. Next question, can the birth control pill help regulate hormonal spikes or irregularities of perimenopause? Yes, the birth control pill will basically kind of takes over, it hijacks your ovaries and tells them to just go on vacation while the birth control hormone takes over. And that in that situation, we are controlling the hormones that your body sees. And so you have more of a steady state kind of hormonal level. So that can control some of the mood changes because now your hormones aren't going up and down. And it also can control your cycle because you can then modify when you get a period if you get a period. So there is that is sometimes a really good strategy. The other piece is that until you are completely menopausal and you're not getting your periods, you still could become pregnant. Even though our fertility declines as we get older, it can happen until you're completely menopausal. And so it's only contraception like birth control pills or the IUD that can prevent pregnancy. Using hormone therapy the way we do in menopause sometimes is not a contraception. It won't prevent pregnancy. All right, next question. I am 46 and had a hysterectomy. I feel like I was thrown into menopause instead of having a natural transition. How may this experience be different from someone who naturally transitioned? I'm experiencing hot flashes and sleep disruption. I'm also dealing with sadness, not sure how much is hormonal and how much is due to the trauma of having the hysterectomy due to endometriosis. That's a great question. So the difference between natural menopause, which tends to happen gradually, and gives you a little time to get prepare and acknowledge, okay, this is really happening. Surgical menopause is abrupt, and so typically, anecdotally, the hormone, the symptoms can be more severe and disruptive. Now, what a lot of people don't really think about on a daily basis is that when you have a hysterectomy, we are specifically removing your uterus, and unless specifically indicated, we're going to keep your ovaries in place. And usually, if only the uterus is removed but the ovaries remain, hot flashes and menopause, typical menopause symptoms don't occur. However, when the ovaries are removed, then you're abruptly menopausal, and the symptoms can be pretty. The difference is that you have a kind of a sudden onset of severe symptoms, and it for some women, it can exacerbate or kind of tip the scales and bring out a mood issue that otherwise may not have been there beforehand. So that's a great question. I'm glad that you asked it, and I definitely would talk with your provider, because even in the setting of having endometriosis, there are strategies that are often safe and extremely effective. So great question.
If I could add on to that one really quickly. There can be a very quick transition in terms of mood and also what this might mean for you in terms of how you identify or perceive yourself. And, you know, I've had patients that have also had like emergency hysterectomies due to other concerns. And with that, we are seeing a little bit of shift in mood. And so I want to say, I think if you are feeling that sadness, it probably is a little bit normal. Your body went through a trauma. You went through something. And so with that, trying to kind of work through that or having, you know, behavioral health could be helpful if you feel it's needed in this situation to help with that transition.
Yeah, it's not as unusual. I'm glad you made that point. It's not that as unusual as you may think. There's a beautiful piece of art of a woman who had a hysterectomy, and in this painting, she has a big hole in her pelvis, and that's how she feels, like she's, you know, this important piece of her is now gone. So I think sometimes we don't realize that it can elicit a lot of emotions, even if hormonally not a lot has changed because your ovaries are still there. Just having the hysterectomy can bring on symptoms, and it's very important to talk with your provider. And then on top of it, if your ovaries were surgically removed, that can be an abrupt change in your hormone environment that also can add to things. The next question is, how can we register on the behavioral health on WellSpan? It's not coming up. Do you know that answer?
So you can self-refer to behavioral health. You can call our central scheduling. The telephone number is 717-851-6340. And you can make an appointment, or you can also talk to your PCP and they can place an internal referral that will go to our system, and somebody would reach out depending on like availability and insurance and stuff. So 2 different ways to be able to seek behavioral health services.
And at the end of this webinar, Sue will put up contact information for Dr. Steele. All right. Next question is, Will someone who has not had children experience menopause differently from someone who has given birth? Not too much. And it depends. I think it would depend if there was, I'm trying to think through any potential differences, but in general, no. Sometimes going through a pregnancy can cause changes to the uterus that can make some of the perimenopausal symptoms a little worse. One of the examples I'm thinking of is a condition called adenomyosis is more common in women who have had a pregnancy before, and sometimes that can cause the menstrual cycle changes during perimenopause to be a little more intense, for bleeding to be heavier, for cramping to be a little bit more intense. But other than that, in terms of hot flashes and other mood changes that would be not uncommon during the menopause transition, I don't think that whether or not someone's been pregnant has a big impact on that.
I would say, to caveat, I think the only thing that could, not the only thing, I'm sorry, I'm going to correct myself. One factor for that could potentially be the transition of no longer being able to have children, like the behavioral health component of that might be a little bit different.
Yeah.
If somebody's going through earlier menopause and hasn't gone through that stage of life, or thought that they had longer in order to do that, to be able to, might impact their perception of going through it from that cognitive self-esteem issue.
Yeah, that is a good point. Okay, the next question. I am 57, hysterectomy with ovaries intact. How do I know when I will go through menopause, or if I am now? I have lots of symptoms. That is not uncommon, that a woman who has had her uterus removed, but she still has ovaries, or a woman who has had a uterine ablation, which caused her to stop getting a period, but she still has ovaries there, or even a levonorgestrel IUD, or the Mirena IUD, which can cause you to stop getting periods, but your ovaries are still there. So how do you know if the ovaries are working, or if you are now menopausal because you don't have the symptom of having a period to tell you? So in that situation, sometimes blood work can be helpful, although the reason why blood work isn't the end all be all or definitive answer to that question is because the hormones that would indicate someone's in menopause can change from day to day. So particularly during the perimenopause transition, when I talked about the hormonal roller coaster, someone may look menopausal if we check their blood work one day, but then the next time we check it, she looks like, a regular reproductive age woman, because the ovaries are allowed to do that. So sometimes blood work can be helpful, but it's not the sole answer. But other symptoms can be helpful. So if a patient is having frequent hot flashes, that's usually an indication that hormonally she's not making a lot of estrogen, because it's the lack of estrogen that precipitates hot flashes. And then we look at some of the other symptoms and try to, it's kind of a puzzle. We put the pieces together in order to see where someone is in their reproductive stage. Which now segues really nicely into the next question, which is, what exactly is perimenopause versus menopause? What's the difference between all the stages? So from the time we get our period, we have entered the reproductive stage. And that reproductive stage, where we have the potential to become pregnant, lasts until we get our last period. And when you have stopped getting periods for a full 12 months, you are officially menopausal. But if you catch what I just said, you don't know until 12 months later that that was your last period. So it's always a retrospective diagnosis. And the most frustrating thing is you haven't gotten a period for 6 months, 9 months, 11 months, and then you get your period, and then the clock starts ticking again. It has to be a full consecutive 12 months. So when you've gotten that 12 months, then you're officially menopausal. But for the 10 years that precede, so 10 years prior to that last final menstrual period, is what we call the perimenopause transition. And basically, during those 10 years, your egg supply starts to decline and go away. And as that egg supply declines, your brain has to work harder to try to get an egg to grow. And so all of the wishy-washy roller coaster stuff is your brain yelling at your ovaries, try to grow an egg. And sometimes no eggs want to listen, so nothing happens. And then sometimes with enough yelling, there's an egg that's like, okay, I'll grow, and it grows really, really well, and you make high estrogen, and you grow a cyst, and so the net result is that roller coaster. And so you can have breast tenderness, mood changes, all the things that we talked about. And we talk about the perimenopause because it's such a long time, it's 10 years. We talk about that stage as early perimenopause, late perimenopause, and mid perimenopause. And it really just tries to define how close you are to becoming definitively menopausal. Unfortunately, there's no good predictor. So there's no blood level or specific symptomatology that says, oh, yep, you are 2 years away from your last period. So it can be a little frustrating in that regard, but that's what I mean by some of the stages. All right.
So doctors,
yes.
Obviously this is Sue. I am unable to put a question into the chat feature because I'm a host, but I if you don't mind, I did want to say a little bit. I really appreciate that you said it's important to seek help when your holistic coping tools are not working. But I'd like you to be a little more, give some more ideas about what those tools would be. I know for myself, I started exercising regularly, and that made a big difference. And I also noticed that I needed to change my diet. I think it's really important to be aware of what can trigger a mood change. It's funny because I discovered that excess sugar can send me into a spiral of depression. Who would have thought? So we're supposed to cut out processed sugar anyway, but that just gave me another reason too. So of course, exercise and diet, everybody knows those are given for everything. But also, I think like you talked about life changes. This is the age where a lot of us go through the empty nest syndrome. That is really hard. And I think it's important to acknowledge that and to perhaps find a new hobby, a new pleasurable activity. It, number one, helps to fill that void and can also be a distraction. And as for when you're having trouble sleeping, breathing exercises, yoga, things like that. I'm just offering these as a voice of experience and just wanted to share.
You're speaking Dr. Steele's love language right now, right?
Absolutely. The other thing I would say is finding hobbies or something like that, but also allowing this time to kind of redefine potentially some relationships. How do we reconnect with partners? How do we communicate in a different way? Because a lot of the times when there are families involved, children and schedules and that empty nest. It's how do we fulfill our days now, right? Because our purpose has shifted a little bit. And so not only through hobbies, but how do we communicate that with our partners too? I find a lot of people have difficulties when they are going through this stage of life and trying to understand what's happening with their mood and their bodies, that how we communicate things changes very drastically, right? Instead of, I'm feeling overwhelmed, I need help, it's, you never take out the trash and it's irritating me.
Right.
as an example. And so part of that might also be focusing on how to express ourselves to help, or have our partners help support us, or have our friends support us, or have our family there, just as like a small caveat of shifting some of the communication as well. It's not always behaviorally, it can be cognitively. Sometimes there's brain fog that comes along with feeling really scattered and things like that. And sometimes that self-care is trying to find strategies to help decrease the stress within the day, not necessarily change it, right? We might not be able to change our responsibilities, but we might be able to find ways to help reduce the emotions that are associated with how many tasks are on our plate, if that makes sense.
I love that. Yeah, acknowledging and accepting and not fighting the transition or what's going on.
And communicating. We typically don't communicate the best. Me as well. I mean, I'm literally a psychologist, and there are some days where my communication is not the best. And that's part of that work through, I think, of finding healthy ways to work through some of the transitions with the people that are also affected by them.
Yeah.
Gardening is also a great hobby.
Yes, and that's perfect timing. Order everyone's seedlings.
Yes.
All right. Well, ladies, it was so nice to spend this evening with you and Dr. Steele. It's always so good to talk with you. Thank you for everything you do for the women and men, but for the ladies in our community. We are very appreciative of your help. And without further ado, I will say goodnight to everyone. Thank you again for joining us, and I hope that you will join us for our next menopause chat. Have a good evening.